out of 3 women within their childbearing age is going to have fibroid. This is backed by research. And that is the reason majority of times when you go for a scan or when you go to check your reproductive system, they can tell you they've seen a fibroid. But I understand the worry, especially for ladies who are trying for a baby. Whenever the diagnosis of fibroid is made, a lot of people are concerned about it because you might have heard that if you have fibroid, it is going to affect your fertility and you're not able to get pregnant. In this video, you'll be learning what fibroids are, what causes them, how it can affect your fertility, and the possible treatment options. So I want you to sit back and watch this video to the end. At the end of the video, I'll be telling you how you can improve your chance to get pregnant even though you have fibroids. So what are fibroids? These are mass of muscle tissues that affect the female reproductive system. It only affects women, it does not affect men. So why do women get fibroid? Recently, there has been a lot of research concerning the possible cause of fibroid and why people get it. But with all the research that has been done on the area of fibroid, the cause is still unknown. So when you go to search or make research about fibroids and you're asking what causes it, what you're going to see is the major thing that leads to women having fibroid is unknown. But one thing is known, and that is it only happens to women during their childbearing age. So scientists have linked it to increased estrogen because this fibroid only occurs at the time when you have estrogen circulating inside of your body, and that is during your reproductive years when you are getting your periods. Once you are out of the reproductive years, that is, you have entered menopause, these fibroids tends to shrink, and it doesn't grow until you have entered the point where you are getting your periods. So they are saying that the possible cause is estrogen. Now, the next thing we are going to be learning is common symptoms associated with fibroids. Majority of times when you have fibroid, it is asymptomatic, meaning you don't get any symptom at all. You can keep on living your life normally, get pregnant, have a lot of children as much as you want. But sometimes fibroids can come with symptoms. These symptoms might even come up to the point where it might not allow you to carry on your daily activities. Some of the symptoms that are associated with fibroid growths are irregular periods, where some ladies can be having intermittent uterine bleeding, that is, getting spotting within their cycle when they are not yet getting their period. Number 2 is heavy menstrual flow. A lot of ladies complain about this when they have fibroids. And number 3 is painful menstrual flow. Because of the position of the fibroid and the size of it, certain ladies will have a lot of pain because of this. So if you're getting these symptoms, it might mean you have fibroid. Other symptoms are frequent urination, painful sexual intercourse with your partner, and having lower abdominal or lower back pain. Now, these things are the things that go side by side with fibroid. But when you're having these symptoms, it does not confirm whether or not you do have fibroid, because there are dedicated tests that can tell you for sure whether you have fibroid or not. And they are ultrasound tests. This involves the use of ultrasound equipment to check your reproductive system. It can be a transvaginal ultrasound or an abdominal ultrasound. Whichever one you go for, the major thing they are looking for is to check whether truly what is causing the symptoms you're getting are fibroids or not. Another way to diagnose fibroid is with the use of hysteroscopy. Now, this involves your doctor passing a camera through your vagina to take a look at your reproductive system. You can also go through laparoscopy, where they make incisions on your tummy and pass a tiny camera to check your reproductive system and see whether or not you have fibroids. Before these diagnoses are made, you would usually speak to your doctor, complain about the signs and symptoms you're getting, then you are sent to go for a test. Massaging your tummy that is done locally cannot determine whether or not you have fibroids. So be mindful of people who will just tell you you have fibroids from just massaging your tummy. It is not a correct way to make diagnosis. How does fibroid affect your fertility? In as much as a lot of ladies will have fibroids and still have a lot of babies as they wish, some ladies might have challenges when they are trying to get pregnant with fibroids. That brings us to the type of fibroids that can make you not to be able to achieve pregnancy, and also the ones that seemingly will not cause issues. There are 3 major different types of fibroid, and they are the subserous fibroid, the submucous fibroid, and the intramural. Subserous fibroids are the ones that are growing outside of your womb. They generally don't stop you from getting pregnant, but you can be having signs and symptoms like heavy menstrual bleeding, spotting intermittently in your period, and having pain. So ladies with subserous fibroid might be asked to go home and try with their partner, especially when there are no other fertility challenges or issues that they might be having. So having a subserous fibroid might not necessarily stop someone from getting pregnant. The next one is the intramural fibroid, which is fibroid growing at the muscle layer of the womb. This particular kind of fibroid will not also stop you from achieving pregnancy, but the presence of it can make pregnancy uncomfortable or even lead to miscarriages. The size of it as well can become an issue because it can cause compression, making pregnancy journey difficult or even leading to recurrent losses. Submucous fibroids, on the other hand, are the type of fibroid that is pushing into the wall of the endometrial cavity. Your endometrial cavity is the lining of your womb, and that is where your baby is expected to grow. This fibroid acts like an intrauterine contraceptive device because it is staying exactly where implantation should take place. And because of its position, it can hinder pregnancy from occurring. So if you have been told you have fibroid, discuss with your doctor the type of fibroid you have and what your chances are with getting pregnant. But usually, you will not find it difficult to get pregnant with fibroids. Now, fibroids occurs in multiple. It can be 2 or 3. Usually, they are multiple. It doesn't occur alone. So you might ask, what are the treatment options? What treatment options are available? Treatment might be to manage the symptom, to shrink the fibroid, or to remove it completely. Treatment to manage the symptoms will be to manage the heavy bleeding that comes with it, or the intermittent spotting, or the pain. Now, you might be given certain medications in this regards by your healthcare provider to manage those symptoms that you're getting. The second one is medications to shrink the fibroid. Some of these medications are to reduce the estrogen levels in your body or to stop production of estrogen totally. Another thing you need to know is that when you are taking some of those medication, you might not be able to get pregnant at that time. So usually it will be to treat the fibroid and then you get pregnant later. But you have to discuss properly with your healthcare provider before going through this option. Other options are surgical options, which involves removal of the fibroid totally. While this offers you relief and also improves your chance to get pregnant if the fibroid is the reason you're not conceiving, it also comes with its own risk, which is risk of scar tissues. If the benefit outweighs the risk, then your doctor would usually tell you to take this option. Another one is uterine artery embolization, where they will put something into the blood vessel supplying the fibroid to block it. Now, this causes the fibroids to shrink on their own. Some of you might be wondering, you're talking about shrinkage of fibroid. Is it possible for it to shrink on its own? Yes, it can. Something we call red degeneration. This is a painful process. The fibroid can shrink on its own, but first it would usually grow past its blood supply, and then nothing is supplying it again, it has to go away. There are certain things you can do from your own side to stop the increase in size of fibroid you already have, and that is lifestyle choices. Research has shown that intake of added sugars and highly processed products or anything that increases inflammation can increase your chance for developing a fibroid and also causing the size of it to increase. Lifestyle choices, high BMI, sedentary lifestyle are the things that have shown over the years to increase the size of fibroid. So living a healthier lifestyle can help you to shrink your fibroid or even help you manage the symptoms you are getting. Fibroids and pregnancy. Certain women will get pregnant and when they go for a scan, they will be told that they have fibroids. Why does this happen? Pregnancy is not the reason why the fibroids started developing. Rather, when you're pregnant, the pregnancy hormones can make the fibroids to grow bigger. During delivery, the position of fibroid might determine whether or not you deliver your baby naturally. Fibroids that are not growing close to where the baby will come out will not stop you from delivering naturally. But when the fibroids are growing very close to the cervix, your doctor might ask you to go through cesarean section. And during your cesarean section, the fibroids might be removed. This is not something that is done all the time, but it is possible to be done. I promised you that I was going to tell you how to improve your chance to get pregnant with fibroid, and here it is. First, learn the type of fibroid you have. If it is a fibroid that requires you to remove it before you get pregnant, talk to your doctor on how you go about it. If it is one that you've been told is not the reason you're getting pregnant, then get to work. Learn what your fertile window is and try to meet your partner as regularly as possible during your fertile window. You would usually get a positive test if there is no other fertility challenge you and your partner has. I hope this video helps all of you. I'm still your Wongo Nation president, and I will see you all in my next video.